when NatHealth reached out to us that to requesting series of webinars, I will be very candid. The first reaction was, okay, we are having yet another webinar in COVID era, because we are having kind of one webinar per week or 2-3 webinars per week at times, and all these videos go and get dumped somewhere on the YouTube, and then that's it. But the proposal that came from NatHealth was very well structured with very clear way forward, if I can say so. I mean, it was very clear from the beginning that it's not just another webinar, but something which is a start of long journey. And I am very happy to see that the report has come out very nicely in a very crisp and understandable manner after this series, which will enable all that was discussed during those 7 and 8 sessions to be actually implemented on the ground. Otherwise, what happens that we keep on discussing in our conference halls followed by nothing. So I think this report actually is a good report in that way that it will hopefully lead to actual implementation on the ground. And this webinar will be in a series of webinars. Actually, this series will actually pave way for adoption of the digital health. I won't repeat what our CEO has stated, but I can tell you that a lot of efforts have gone in development of this ABDM platform. You all are aware about the modules, etc., which we have developed over the last 2 years with the help of industry after taking your feedback. But the policy making was also required. This was totally, lot of vacuum was there. So like there was nothing to talk about management of health data, how consent will be given, who will give consent, and who will be actually in control of data. While it is clear that we have to abide by PDP bill, but it is still a bill and not an act. So there was a policy vacuum which we tried to fill. We developed modules, and most importantly is that we have to now adopt it. Our role is to develop a platform which creates an opportunity for private developers and also for government entities to plug into their solutions into this common platform and start using it. So the ABDM as a platform itself is of no use unless it gets integrated with various solutions, and many of the solution providers are, I believe, present today. I'm very, I mean, we are very encouraged by the fact that we right now have 800 plus integrators on our sandbox, which is a very good sign, given that not even 6 months have elapsed since the national rollout of ABDM. We discussed numerous topics or subtopics related with ABDM, obviously in addition to general introduction, about what is the mission and how the design, architecture, etc., standards, etc., have been formulated. We went into very specific points: how doctors can benefit, what the hospitals can expect, how citizens can use, what is UHI, what integrators or health tech companies can do. So these are very specific points where a specific group of stakeholders can understand, and they could get chance to ask their queries, which were responded to by those who are addressing and the experts. And I'm also happy to note that the reach of these series of webinars was also very wide. We could reach out to thousands of people, thousands of stakeholders. Now, what is required going forward is a continuous engagement. I will say that this is a kind of good beginning that we have done, but not the end of it. We have to ensure that these 800 plus integrators reach the finality of integration, start using their solutions, start generating digital records. I know there are many digital health solutions and even within government which are installed in various healthcare facilities, but they are just installed and not used. Because there are lots of issues. There are issues about user interface and user experience. There are issues about connectivity, the speed of the processes. We have to tackle all these issues. We cannot tomorrow go and say that, okay, we have installed these solutions in these many mobile phones, these many apps are downloaded, these many hospitals have these many PCs with all these kinds of solution. Ultimately, we have to have digital health records which will flow freely between various entities, obviously subject to the consent of the patient, and which will enable the benefits of digitization to be provided to all the entities, like proper analytics, proper clinical decision support system, public health decisions, then longitudinal medical history, and then reduced cost of healthcare, remote connectivity, this equitable distribution digitally of the healthcare providers. So all these benefits we must ultimately intend to reap for one and all, everybody in the India. And I think this webinar series and this report, I believe, can play a key role, a crucial role in this, our ultimate objective of ours. So I thank the NATHEALTH and organizers and all the members of NATHEALTH for starting this journey together. It's going to be a long journey. It's going to be a difficult journey. I understand this is the most complex digitization that one can imagine at this scale. And I look forward to your continuous support in this particular endeavor to make India the next powerhouse of digital health. I thank you, organizers, once again for having me here, and wish you all the best. Thank you.